Hello, today I'm going to talk about the setup and operation of the Medrad Power Injector, the Mark V version. So most of you will know this as the old power injector. So first you will need to obtain a syringe for the power injector. As you can see here on the left, it says Medrad Mark VII. This is the syringe for our new power injector, and Medrad Mark V on the right is the syringe that you will need to operate the old power injector. If you were to open both of the packages for the syringe, you would notice that this clear syringe on the left is the one that belongs to the old power injector, or the Mark V. This is the one that you will be using, while the one on the right here is the one for the new power injector, the Mark VII. The setup of this power injector is very similar to the other power injector. Once the syringe is loaded, you will be attaching the straw that looks like a hook here in this left picture to the tip of the syringe and withdrawing the contrast into the syringe to fill the syringe. As you can remember, Dr. D. Perini does not dilute his contrast. He uses VisiPake full strength. All the other vascular surgeons use VisiPake mixed half and half with IV normal saline. You will fill the syringe in the same method as the other power injector, and if you need further instructions on that, please refer to the power injector instructions and/or video. To use this power injector, you will first turn on the power injector right here on the side. Once you turn this on, the display will light up here on the screen, displaying a series of numbers and settings. This yellow sticker at the very top will be your guide for what the typical settings should be, but as always, confirm with your surgeon and they will adjust them accordingly. All of these small triangle buttons in each column will change the settings. So if you wanted to change a setting in any of these columns, for example in flow rate, you would simply push the triangle. As you can see, the set button is flashing. You will type in your new settings and push the triangle again. The set light is now solid, which means that number, that rate is set. In this flow rate column, there is another triangle right there, number 3, that will change the measurement of your flow rate. You always want to make sure it's in mLs per second, and that mLs per second is highlighted. All of these buttons in each column will function the same way to change the settings. There are a yes and a no button here. At the end of priming, it will ask you questions. You can hit yes or no. And then right here in orange is a single or multi-arm function. We will be using single arm. Back again, here are these yes and no buttons. When you have filled your syringe, it will ask you if you have removed the air bubbles. And you always want to say yes because you have. This power injector is not connected to the bed like the other power injector, so you do have to perform a manual injection. This means that the circulator standing off the field will be the one who pushes the button to inject the contrast. When the surgeon is ready and the circulator is ready, you will confirm with the surgeon that you are ready to inject. They will instruct you when to inject. You will push and hold the button down until it has a series of beeps, which means the injection is complete. But first, we have to insert the syringe and get the contrast in. So there are little grooves here on the syringe specially made for this power injector. You will simply slide the syringe in the bottom, out the top, lining up those little grooves. Once you get the syringe in, you might have to twist it around slightly to ensure that it is aligned, but it will only fit in one way. Once the syringe is in, you will spin the holder around, locking it in place. You can remove the orange cap now at this point, and you could begin to fill your syringe. Something to make sure you look at on the bottom of this arm here is disengage or engage function. It shows you which way is which, and that is important because you cannot effectively withdraw the syringe, the plunger in the syringe, if it is not engaged correctly. You can tell up here at top if it is engaged or disengaged, but honestly the best way to tell is when you are moving the syringe. So like I said, we want to have it in the engaged position. So if you are advancing the plunger forward, because we are going to be with removing air, you will advance it forward. When it is time to withdraw the syringe, if this were to be in the disengaged function, what would happen is when you withdraw, your plunger is not attached, which means you cannot withdraw the contrast to fill the syringe. It's okay if this happens. Simply advance again until everything is connected, engage, and then you may withdraw your plunger, filling the syringe. As previously mentioned, this power injector works in the same fashion as the other power injector, where you would push the middle round button and then the arrows up or down, depending on if you want to advance or withdraw the plunger. Further away from the middle will make the plunger advance or withdraw quicker, whereas pushing closer to the middle will move it back slower. Once you have removed all the contrast into your syringe, you will then purge out air bubbles. Once this is complete, you will connect the tubing from the sterile field to the tip of the syringe, tilt the arm downward, press the single arm button, and tell the surgeon that you are ready to proceed with the injection. If you have any further questions or need any further clarification, please don't hesitate to speak to the team leader or to the educator. Thank you.